Thank you very much, Presiding Officer, and I very much welcome the opportunity today to give my first speech in my new role as Cabinet Secretary for Health and Care. And I commit to Parliament today to do absolutely everything in my power to protect, renew and reform our National Health Service, our most precious asset. And that demands that I not only work hand in hand with our exceptional health and care workforce and partners, but also members across this chamber to address local issues and improve the health of our nation. Presiding Officer, I want to take this opportunity to thank my friend and colleague, Neil Gray, for his focused leadership that he has shown over the past 2 years, which has seen our NHS turn a corner. And Mr Gray and I will continue to work together on matters that require joint action between the world of health and the world of justice. And I also very much want to thank my good friend Jenni Minto for her pioneering work in the Women's Health Plan. And people will be well aware that Scotland is or was the first in the UK to deliver the Women's Health Plan. And that work will now be taken forward by Maree Todd, who has always been a champion for women's health, whether as an MSP or indeed as a pharmacist. Presiding Officer, before I provide an update on progress, I would like to note my support, although not accepted, to the amendment from Miles Briggs, which rightly highlights the importance of high-quality, accessible palliative care and the vital role that hospices and community services play for people and families across Scotland. And I commit to working constructively with the member on this issue to ensure cross-party input on the future of palliative care. On the amendment put forward by the Greens, I am also supportive of the sentiment. We will take forward a workforce plan on pay. I very much recognise that pay is a barrier to people entering the social care workforce, and I am determined that we will do more to improve pay and terms and conditions. However, the budget is set for this year, and to increase to £15 an hour right now would cost in the region of £325 million. Of course, we always remain open to negotiations with the Greens ahead of the next budget, but the reality for this year is that cuts would have to be made elsewhere in our NHS to deliver this amendment, and that is why we cannot support it today. I am supportive of mandatory sectoral bargaining, but we are constrained by the reserved nature of employment law, and we will support the UK Employment Rights Bill when it comes for legislative consent. But in the meantime, it's why we have introduced plans for voluntary sectoral bargaining in March, something that I know that the Greens have called for, and we are already working with partners on this. I also support improvements to terms and conditions, including measures such as enhanced maternity leave provision and support with PVG checks. And more broadly, the Government has supported providers this year to deliver the real living wage, and we are clear this was conditional on ensuring providers uphold our fair work principles. And I hope these measures that I have set out provide an indication to colleagues of my keenness to work together, and I ask that they support the Government's motion today. And if I can just quickly say to the Liberal Democrats, next week I will make a statement with respect to maternity services. And if I could say to Reform UK, I am not supportive of establishing a Health and Social Care Commission, because of what the public are telling us right now is that we need to focus on delivery. And to my colleagues in the Labour Party and to Jackie Baillie in particular, while this is not the worst amendment I've seen from the Labour Party, I would have hoped that we could perhaps have started on a slightly more positive note, but we'll work on that, and we'll work on that together, because that's what the public demand of us all. So, Presiding Officer, now turning to the substance of today, the pandemic, as we will all recall, was one of the greatest challenges the NHS has ever faced. And the system responded with remarkable dedication to both the immediate crisis and to the journey of recovery. And it is therefore right that I begin by recording my sincere thanks to all health and care staff for the incredible work they do. And I had the pleasure of visiting the NHS Golden Jubilee Hospital today, where the commitment was clear to see. The hospital has now become the UK's largest centre for hip and knee operations. And my visit also allowed me the opportunity to speak to patients, and whilst I absolutely recognise there are still some people waiting longer than any of us would like, I am hearing the progress we're making, and that is having a real impact on patients and their families. And I'm also hearing about the creative solutions being used to ensure patients receive the right care in the right place at the right time. And this includes expanding our innovative Hospital at Home programme by the end of this year and become Scotland's largest hospital, as well as harnessing digital advances such as AI to speed up lung cancer detection in Grampian. NHS leaders are also spearheading a new subnational planning approach, which has already seen better collaboration and a sharper focus on shared priorities. And this is a material shift in how we think about population-based planning and delivery. And it will see health boards working together across east and west of the country to jointly develop and deliver services. And this will help more effectively direct and share resources, reduce duplication of effort and improve equity of access. And this approach underpins the transformation we need in shifting care closer to home, focusing more on prevention and inequalities and better aligning resources with needs, for example, during periods of increased demand like flu season. Of course I will, Mr Baxter.
You've spoken about working collaboratively and moving care closer to home. So could you explain how you intend to implement the Ritchie report and reintroduce 24/7 urgent care at Poultry Hospital? And will you meet with me and the SOS Poultry Hospital Group to explain how you will do so?
Cabinet Secretary.
Thank you, Presiding Officer. And I very much appreciate Mr Baxter's intervention. I have been advised, but I will indeed want to test this, that significant progress has been made. And of course, I would very welcome a discussion with Mr Baxter on these matters. Presiding Officer, our commitment to tackle long waits is unwavering. And while we did not meet our March target, this was a stretching ambition, and what matters are the actions that we're taking to go further. The latest data shows that new outpatient waits over 52 weeks have fallen for 11 consecutive months, with inpatient and day case waits over 52 weeks reducing for 15 months. And since July 2025, waits of over a year for new outpatient appointments have fallen by 76%, and inpatient and day case waits of over a year have almost halved. And secondly, we are also seeing really good progress in diagnostics. And in the latest quarter, activity was at its highest since reporting began in April 2024. And that means thousands more people are getting their scans and their scopes sooner, helping them to get a faster diagnosis. In terms of activity, I am very pleased to confirm that we have not only met but exceeded our additional activity target, delivering more than 168,000 additional appointments and procedures in 2025-26 compared to the previous year. And data published yesterday shows a 7% increase in operations performed in the past 12 months. And our national treatment centres have been vital to this success and have delivered over 34,000 surgeries and procedures between April and December 2025, surpassing our annual target 3 months earlier. However, Presiding Officer, I want to be very clear that I want to go much further, and we have to go much further. And I want a system that is not only in balance, but is able to respond to demands and ensure all patients are seen quickly. And that means delivering on our manifesto commitment of ensuring that no patient waits longer than 26 weeks for treatment by the end of this parliamentary term. We're also seeing improvements in cancer services too. We are treating more patients on time within both standards than we did pre-pandemic. For example, over 95% of patients started treatment within 31 days of the decision to treat, with a median wait of just 2 days, the joint lowest on record. And this progress has been helped by expanding the rollout of our rapid cancer diagnostic services, including the new service in NHS Forth Valley, which opened last year. And we are working on a new cancer action plan, which we'll publish later this year. Now, I know for the public, pressures in unscheduled care will be a concern. And let me be clear, corridor care and long waits in A&E are just simply unacceptable. And I am absolutely committed to improving care, improving performance and reducing delays. And the reality is these pressures don't start at the front door. They're caused by blockages across the whole system. So our focus has to be on practical, immediate action to tackle the underlying challenges, working collaboratively across the NHS, local government and key partners to deliver better, faster care. And that's why within the first 100 days of this Parliament, we'll publish a clear plan to improve patient flow, building on the progress already made through our investments in NHS 24, the Scottish Ambulance Service and the front door frailty services that we now have in every health board. Lasting improvement also means, Presiding Officer, addressing the challenges that we have in our social care sector, which has, I have to say, been exacerbated by the UK Government's hostile approach to migration and the financial burden heaped on providers thanks to the increase in employers' national insurance contributions. A significant part of tackling pressures in our hospitals requires us to continue to move more care into communities. And new community health hubs, new lung and heart health MOTs and 30 walk-in GP centres from Shetland to Stranraer. Yes.
Secretary give way. And I join with others in thanking the NHS staff, but I want to include in those the maternity services across rural communities, particularly in Galloway, where they're under pressure. However, if reform and renewal are going to mean anything to families, the Cabinet Secretary must ensure that there's real progress and progress at pace. In January, the government said that Stranraer would be among the first rural areas targeted by the new maternity and neonatal task force. Yet women in Wigtonshire have seen no change, and there's still no planned births at Galloway Community Hospital, resulting in too often in a 70-mile dash to Dumfries. Will the Cabinet Secretary say what has changed for families in Galloway since Stranraer was defined as a priority, and when do they expect to report on maternity services and provide clarity over maternity services, particularly in Stranraer?
Cabinet Secretary.
Presiding Officer, I very much appreciate the contribution made from Finlay Carson. He touches on something that is, I can assure him, important to every Minister, myself, Maree Todd and Alison Thewlis, as we take our work to renew and reform the NHS forward. I will be happy to ensure that he's briefed about the work of the task force, because that has to have and does have a focus on the workforce, where it is, how it works, how we support the workforce going forward, but at its core, how women and their babies are looked after. And as I said in reference to the Liberal Democrats earlier, I will be returning to Chamber next week to make a full statement with regards to a range of issues impacting on maternity services. And in particular, I'm, from my colleague Maree Todd, very aware of the rural challenges that part of our country face, whether it's Stranraer or indeed Caithness. Presiding Officer, in terms of the GP walk-in centres, we have 6 of these centres open already. We have GP numbers going up, and in tandem we are delivering on the historic deal reached with GPs last year of £531 million investment into primary care, and this will further boost the recruitment of GPs. Supporting people closer to home is only part of the story. We also need to act earlier, preventing ill health wherever possible, and we are focused on the wider factors that shape people's health. For example, in October last year, we took an important step of bringing in legislation to limit the promotion of foods high in fat, sugar and salt. And I'm happy to give way to Mr Simpson.
Graham Simpson.
Thank the Cabinet Secretary for taking the intervention. I just want to ask the Cabinet Secretary, but she may not have the answer yet because she is new to the job, but when can we expect to see an NHS app with the functionality that exists down in England? Because I've been asking for this for years now, and frankly, patients in England are doing a lot better than we are.
Cabinet Secretary.
Presiding Officer, I will in a moment or two come to that very issue because we do have some important progress to update Parliament on, and I would hope that it would reassure the member in terms of the functionality and how we will end up with the best app on these aisles. But we will come to that if he just bears with me one moment. Presiding Officer, I had left my remarks before the intervention in and around public health and protection, and I do want to just quickly advise that the Tobacco and Vapes Act, which gained royal assent in April, is a landmark step in delivering a tobacco-free Scotland by 2034, and in the first 100 days we will consult on a ban on vape and nicotine product displays. Presiding Officer, alongside improvements in other areas, mental health remains a key focus. It's a subject area very close to my heart as a former social worker and mental health officer who worked for several years at the State Hospital and also in 3 prisons. And I am very conscious that access to service is improving, particularly for our young people. Long waits for CAMHS are at historic lows, and we have met and maintained the standard for CAMHS waiting times a year ahead of target. And we have also invested an additional £3.5 million to improve our 24/7 response to mental health emergencies, and this includes the expansion of our existing NHS 24 mental health hub to include psychological therapies which respond to around 10,000 calls from the public each month. And our manifesto, of course, commits to doing more. The First Minister today visited the Nook in Glasgow, run by Sam H, which we will be supporting to deliver more drop-in mental health centres across Scotland, and will also be expanding the use of mental health triage cars, which the ambulance service already utilises in Fife, Inverness, Dundee and Glasgow. So, Presiding Officer, looking to the future, I am confident that the progress I've set out today provides a strong foundation to build on, and I am clear about my determination to do just that. And a significant step in our programme of public service reform is the establishment of Public Services Delivery Scotland. From the 1st of April, we brought together the functions previously delivered by NHS National Services Scotland and NHS Education for Scotland within a stronger, more streamlined national delivery body. PSD Scotland supports our Once for Scotland approach, strengthening national capability while remaining responsive to local needs. And it is important to stress that PSD Scotland is not just for the health service. It can bring other benefits to the public sector. Looking to the future, we know that digital infrastructure and technological innovations are absolutely key, and we are making marked progress already. Our digital dermatology service, introduced last year, is now available across all GP practices in Scotland, and we estimate 130,000 dermatology referrals a year could be made this way, reducing demand on dermatology waiting lists by up to 50%. And in April, to Mr Simpson's point, we also made mycare.scot available nationally, and this gives people a simple, secure way to see and manage aspects of their own health and social care online. And a downloadable version of the mycare.scot app will also be available in app stores early this summer. And we're committed to NHS Scotland data always being in the hands of the NHS, unlike perhaps what's happened elsewhere. And data will, of course, remain within the control of our NHS, and we won't be getting involved with the likes of Palantir. And I want to just be clear, for the avoidance of doubt, Scotland will never ever, Scotland's NHS will never ever be up for sale. Presiding Officer, the progress that we are making is undeniable, but let me not shy away from the fact that there is much more work to do. And we must do the hard work of reforming our public services, cutting unnecessary bureaucracy and making access to healthcare easier for the people that we all serve. Above all, this is about people, the staff who deliver dedicated care each and every day, and the patients and families who depend on our health and care services. And they will be at the heart of absolutely everything I do. Thank you, Presiding Officer, and I move the motion in my name.
Thank you.